Liposuction surgery has been here since about 1984 when Dr. Gerard Alous presented to the Plastic Surgery Society his series of 1,000 patients undergoing liposuction surgery. And they were unbelievable results. We didn't even believe that something like that could be done. It was really one of those game changers in the plastic surgery field, because today, by procedure, that's the largest numbered procedure done statistically in cosmetic and plastic surgery. And so within a year, I trained to do liposuction surgery, and I've been doing it ever since. There have been tremendous advances. The biggest one was when Dr. Kline introduced tumescent anesthesia, which we use in our awake anesthesia, which allowed us to take more fat, spend more time, have patients more comfortable, and finally get away from doing some of it under general anesthesia, not having blood loss so great we could only do a couple of areas. Then we had ultrasonic liposuction come along, which evolved into the vaser and the laser, and that's a real advantage for patients who have more fibrous tissue that's harder to get through, where we can't quite remove the fat, and the vaser liposonic surgery helps with that. The other advances were laser surgeries, and laser is said to melt fat. Well, laser can only fry. You can fry bacon and you can fry fat, and that oil that's left behind after you break it up can cause a lot of scar tissue. So when we do our micro lipo, even though I had to spend $10,000 to get certified to do the Smart Lipo and can do that at any time, we don't use that because it causes more scar tissue. So what we find is, by using micro lipo, where we take cannulas that are about as big as a cooked spaghetti and have a series of small incision sites about as big as the hub of a ballpoint pen tip, just that little plastic very tip, and go in different directions, we can remove up to 90% of the fat. Well, nobody's removing 90% of the fat except me that I can find. And to do that, you have to spend the time. So if you want to know the job somebody's going to do for you, ask them how many cc's of fat are they going to remove, how many pounds they think they're going to remove, but more importantly, how much time they're going to take. And when we do our micro lipo and use those very small spaghetti cannulas, we take out fat a grain of rice at a time. And when we take out fat a grain of rice at a time, times 500,000, we can take up to 18 pounds of fat. We can take up to 15 to 18 inches around the body girth, and we've gotten up to 15 percentage points of BMI points. So this micro lipo is truly today the cutting edge technology, but liposuction surgery is the only surgery I know that the better you get as a plastic surgeon or a liposuction surgeon, liposculpture surgeon, the longer it takes you. And it's not because I'm old, and it's not because I'm lazy. It's because I spend the time to get the results patients want, and that's how we get these fantastic before and after pictures. Visit our website at www.cliniquelipo.com or come in and see us. We're also at 866-972-8578. Thank you.